Hey guys, it's Matt from 5 Doc Physiotherapy and Sports Injury Centre and Brandon as well. I hope you're having a wonderful day today. Now, today we wanted to come to you with a Facebook Live. We're talking about the best management strategies for your child if they're struggling with growing pains. Now, if you're watching, please press like or comment below so that we know you are there, and make sure you're watching until the end. We've got a really good resource for you. So, growing pains in children can be due to a variety of different reasons. What are they, Brand?
So pain might be due to your muscular tightness, poor posture, but it can also be due to a variety of different conditions in the knee, such as arthritis, infections, or typically a range of conditions what we know as traction apophysitis. Effectively, it occurs on the bones that grow when they grow a little quicker than the muscles and causes a traction type force. In the knee. It presents at this part of the knee, down on the front, leading to resultant irritation and inflammation in that area.
Yeah, awesome. So one of the more common areas, as you alluded to, is the knee, and that condition's often called Osgood-Schlatter Disease. Effectively, what that means is that your thigh bone is growing quicker than the muscles, and we end up with this tractioning just down in through this section here. Now, with this type of condition, there's a bunch of things that we can do to help our children manage their sore knee. So what do you think we should do, mate?
Well, step one is to get a diagnosis. Yep. So our physios are able to assist with this and give you a really clear diagnosis so we can manage your adolescents' symptoms, make sure we enable them to continue to lead an active lifestyle. It's also really important that we rule out at this point any serious pathology and go get some x-rays if needed.
Absolutely. I guess step two would be load modification. So once a diagnosis is made, it's really important to modify activities such as training, competition, to offload the knee and allow symptoms to settle in the acute phase. Now, this means an initial reduction in the total load, but doesn't mean that the child has to stop participating in sport or training altogether. Physios are really good at leading this process of returning to training and sports in full once safe and appropriate to do so. What's management strategy number 3, mate?
Well, you also have to have some other strategies to help manage pain along the way.
Absolutely.
So some really good ways to do this would be some soft tissue work and manual therapy techniques that our physios here use to help reduce the muscle tension and settle down the symptoms. Yeah. Taping is also sometimes an effective measure to offload the side of pain, as well as some foam rolling to help at home get that soft tissue relief.
People really like that sometimes. I don't know about the evidence, but people really like it.
Absolutely. But also our physios will prescribe a progressively overloaded exercise program to help strengthen the muscles, tendons, and build tolerance to that site of the bony attachment so that we can essentially increase that load capacity of the knee. We also look at the biomechanics of that person as a whole to ensure that muscles are activating correctly and not contributing to our symptoms.
Awesome. So last step is icing. So ice can help reduce the pain and any irritation or inflammation that's present. So 10 to 15 minutes of icing following activity can really help settle down and improve comfort levels kind of significantly. Now, if you'd like to know a little bit more about Osgood-Schlatter disease or your child's complaining of a sore knee, why not check out our blog, follow the links below. There's some really good information that you might find super useful. Alternatively, if your child is troubled by pain or an injury, give us a call in the clinic on 9713 2455. Hopefully you found all this information super useful and beneficial for your child. Thanks so much for helping us out today, Brandon.
Not a problem.
Much appreciated. Cheers, guys.